So now this is the final stage in the adenoid when the major tissue has been removed. Now I'm starting with the superior boundary. Now see, I'm removing the last layer in the superior boundary, which is the periosteum below the sphenoid bone. Now you see, layer by layer, I have removed. Can you see the periosteum now very clearly? That's the final thing. Don't open up this periosteum. But I am removing all the lymphoid tissues layer by layer completely. That's the superior boundary. Now I am following this superior boundary posteriorly. So this is the torus tuberous, that's the eustachian tube. If I follow this boundary posteriorly, I'll get into the, if I follow this superior boundary posteriorly, I'll get into the posterior boundary, which will be the buccopharyngeal fascia. So now that this is the superior boundary completely cleared, you can see the buccopharyngeal fascia already partly here. I'll show it to you completely. We are not supposed to open up the fascia. We're only supposed to define the fascia. So that is the fascia. Whatever little tissue here and there is there, you can simply hover on those tissues and remove them. But you do not open up the fascia at all, because that will unnecessarily cause pain. Now that's the posterior boundary. What is the lateral boundary? Lateral boundary is the torus tuberous in the anterior part. So obviously there's a little bit of lymphoid tissue on the torus tuberous, which also I am ablating. You can coagulate, you can ablate. Since I can see the lymphoid tissue very clearly, I am ablating the lymphoid tissue. That's the torus tuberous lymphoid tissue already ablated. If you are not sure, you can coagulate. But here I am very sure, so I have ablated. Now, as you follow this behind, this is the lateral boundary posteriorly, which is the fossa of Rosenmuller. This is the lymphoid tissue in the fossa of Rosenmuller. So this much tissue is actually left behind after the routine adenoid surgery, which I am cleaning from all the boundaries. So this is a work of 16 years. We started in 2008. We came out with a paper which is published in the Indian Journal of Otolaryngology in 2016, and this video is being made in 2024. So overall this is a work of 16 years. Now that's the fossa of Rosenmuller, which I am trying to completely clear. Make sure that you are not seeing any pulsating vessel, which is the aberrant carotid artery or a branch of it, and do not direct your wand laterally. So direct the wand medially so that you see the tip of your wand. Now see how much tissue was still there. Alright, so this is the buccopharyngeal fascia which you see on the posterior boundary very clearly. Alright, now we come to the inferior boundary, which is the passavant's ridge. So obviously this area, once you go near the muscles, you will see a twitch. The muscle will be horizontal. So you'll see a horizontal twitch. So far there is no twitch. So I know that I am away from the muscle. Obviously muscle will come only after the fascia. So unless you go very near to the fascia, you will not see the twitch. So this is the last part, and now can you see this twitch? This tells that you are now nearing the horizontal muscle. and that's your boundary. And you see the adenoid ends over here. You're not supposed to open up the fascia, you're not supposed to open up the muscle, you're only supposed to remove the lymphoid tissues of the adenoid. That's it. Alright, so as you see here, you have not opened up the fascia anywhere. This is the boundary on the right side. Alright, this is the superior boundary, periosteum below the sphenoid, lateral boundary anteriorly, which is the torus tuberous, lateral boundary posteriorly, which is the fossa of Rosenmuller, posterior boundary, which is the buccopharyngeal fascia, and inferior boundary, which is the torus tuberous on the right side. Now I'll do the same thing on the left. Hold on. So obviously, you should prevent any trauma to the turbinates while decongesting. Now you see, a lot of work is pending here, right? This is the torus tuberous. This is the adenoid tissue. This all is adenoid tissue. So I have to do a lot of work. Can you put some saline? So I will start again from the superior boundary. Superior boundary is the periosteum below the sphenoid bone. If I leave all these tissues, then they will tend to regrow. They will tend to, uh, give symptoms. I'll remove all these. So in this video, I have started from where most of the people will end their surgery, right? Because they believe that if you remove 70-80% of the tissue, the obstruction is gone. But obviously, the allergy is going to persist. The growth spurt of the child is still going to be there. The lymphoid growth spurt also. Let me just focus it a little better. All right. Thank you. So now this is the torus tuberous, and you can see the lymphoid tissue on the torus tuberous. So this is the lateral boundary anteriorly. This is the fossa. This is the eustachian tube orifice. I'll remain 5 millimeter away so that I do not create a problem. Now, when I follow this lateral boundary posteriorly, I'll get into the fossa of Rosenmuller, which is this. We'll clean it completely, and that's the buccopharyngeal fascia at the back. So we'll completely clean up the fossa of Rosenmuller, not directing our wand laterally. We'll remain superior or medial so that we do not accidentally open up any blood vessel, which is a direct branch of the carotid. Generally, if there is something, you will see a pulsation, so it will guide you that there is an aberrant vessel. Obviously, there is none in this case. So that's the buccopharyngeal fascia, right? Will not open up the fascia, will only define the fascia. All right. So now the last bit, and this is the passivants rich area. You can see the horizontal contractions of the muscles. Be careful. This area you can get an aberrant carotid. So best is to direct your wand medially. I'm going behind the torus tuberous. Directing the wand medially, I can go inside and remove all the tissues. Now, if you're not very confident, you can coagulate it. So you can go inside and you can coagulate these tissues. If you're not very sure, do not try to ablate, coagulate it. All right. So you can always coagulate this bit of tissue, cushion of tissue, which is behind the torus tuberous. Here, since I can see very clearly, I am ablating now. All right, so that's the end of our surgery. Whatever little amount of tissue was there, these are the boundaries of the adenoids. Thank you for watching.